Hey everyone, it's Erin. This week I am doing mock therapy for a 7-year-old with pragmatic difficulties. Unfortunately, I don't have a 7-year-old with me, so I will be playing both parts as the clinician and the client. And also, this activity calls for a pumpkin, and I don't have one, which I'm really sorry about, but we will be pantomiming hollowing out a pumpkin. Okay, so this first activity, the client and I are going to take turns drawing features for a jack-o'-lantern face. This client has difficulty with turn taking and topic maintenance, which are the main two goals I will be targeting in this session. So, first one, because it's important to play off of what the kids are interested in. This particular client, who I'm basing off of my little sister, who has similar difficulties, is very creative, loves to draw, loves to do art, and is very tactile, which is why we're going to be hollowing out a pumpkin together. So, let's get started. Okay. Hi, Sophia. How are you today? I'm good. How are you today? I'm good, thank you. Today we're going to take turns drawing a pumpkin face. Does that sound like fun? Yeah, it sure does. This is terrible, I'm so sorry. Okay, would you like to draw the first eye? Yeah. Here's the marker. Okay. That's a really good eye. Alright, now I'm going to draw the next eye. Now you can draw the nose. Very good. Now I'll draw the first part of the mouth. I'll draw the top part. And now you can draw the second part. Very good. Now do you want to add anything else? Maybe some stitches or an ear? Very good. He looks very scary. I think I'm going to draw an eyebrow. Do you want to draw another eyebrow? Very nice. He's looking really scary. Now, here's the design that we co-designed. I really hope that was, an effective demonstration for taking turns with the face and kind of using teamwork to make something together. Now, move on to the next part, and again, I apologize for not having a pumpkin. I didn't have time to go to the store, but we're going to pretend we have a pumpkin. So I'm going to pretend to cut it open. And in real life, you want to make sure you keep the knife away from the child. When you're done with it, put it way to the side away from them and be very, very careful. I feel like it goes without saying, but I just wanted to clarify because, that would be bad. And so, if I had a real pumpkin, I would have some gloves if the client wanted them, as well as spoons. An ice cream scooper is really good for hollowing out a pumpkin, and a bowl to put all the guts in. So here's our pretend pumpkin. Here's our pretend bowl out of sight. And so now two of us are going to take turns hollowing out the pumpkin. I'm going to ask her about things she likes to do in fall to practice topic maintenance. And if she starts to get off topic, I will gently guide her back to the question that I asked. Okay, here we go. Okay, Sophia, now it's time to hollow out the pumpkin. Are you excited? We're going to use If you want to use gloves, I have them right here, but I don't think you're gonna want them. No, it's fun to feel the squishy pumpkin innards. All right, so let's grab our spoons. We can start scooping. Scoop, scoop, scoop. All right. Now, Sophia, while we're scooping out the pumpkin, I'm going to ask you some questions about fall. Does that sound good? Great. My first question is, what is your favorite thing about fall? My favorite thing about fall is when the leaves fall down. Then I like to walk and step on them, making them get crunchy. My favorite food is pretzels because they're also crunchy. I like crunchy things. That's great, Sophia, but what do pretzels have to do with fall? Oops, sorry. That's okay. It's good to practice staying on topic, and there's no shame in, there's nothing wrong with going a little off topic. What else do you like about fall? I like getting ready for Halloween. I want to get all the candy in the neighborhood this year. Oh yeah? Do you have a costume picked out? Not yet, but I really want to be Hiccup from How to Train Your Dragon. That is an awesome costume. My sister loves those movies. She watches them all the time. They're my favorite movies too. What other movies do you like? I like a lot of Disney movies. Oh yeah? Like what? I like The Lion King and Moana and Frozen. Ooh, Frozen. Are you excited about Frozen 2? Yeah, I sure am. I like Olaf the best. I named my cat after Olaf, but we call him Ollie. His middle name is Jigglypuff, like the Pokemon. Do you have a favorite Pokemon? I love Pokemon. My favorite is Pikachu, but I also really like all the legendaries and the starters. I like them all, but Pikachu is my favorite. My favorite is Psyduck. Oh my god. Alright, so the therapy would continue in this fashion, and I know I'm not doing a very good job demonstrating it because I just don't have a child with me, and this activity is about stimulating conversation, practicing topic maintenance, and some turn taking. And with one person, it's kind of ridiculous to watch, but I don't have a child around to help me with this, or an adult. So with this activity, it's important to make it interesting with the pumpkin, because otherwise you're just talking, and that can be really boring for a child. And so using the pumpkin to include some tactile sensory stimulation is really important, because kids thrive off of sensory stimulation. Since I'm basing this imaginary client off of my younger sister, I know she has a lot of sensory difficulties, and whenever there's something tactile for her to focus her body on, her brain can focus more on other things like pragmatics. And so when she has something to do with her hands, she is much easier to talk to. And so that's a good, tip for giving therapy to a child with sensory needs. Have sensory, if they respond well to auditory, then put some music in the background. If they respond well to physical touch, then rub their back a little bit. There are sensory vests that provide compression that help to calm children down. That's another really good thing to integrate into therapy. But yeah, there are so many different ways to include sensory input, and it's important to tailor it to what your client needs. If your client hates being touched, then you want to make sure that they have another way to get their stimulation without touching them, because speaking from experience, if you don't want to be touched, being touched is a nightmare. But yeah, so with this client, we worked on turn taking and topic maintenance, and we related it to fall because it's fall right now. It's October 27th, and Halloween's only a few days away. Kids everywhere are getting excited about Halloween, free candy, but it's also important to remember that if your client doesn't participate in Halloween for cultural purposes, to steer clear of that because you want to be sensitive to your client and their needs. And yeah, bye bye.